Thousands of flags blanket the National Mall in Washington today, honoring the 200,000 Americans killed by the coronavirus. Each one of the 20,000 flags near the Washington Monument represents 10 people whose deaths are linked to COVID-19. This morning, there was an interfaith memorial service to mourn the lives lost. Nationwide, the average rate of new coronavirus cases has increased to roughly 40,000 per day.
Joining us now, Dr. Mary Jo Trepka, professor and chair of the Department of Epidemiology at FIU, also former director of epidemiology and disease control for the Miami-Dade County Health Department. Dr. Trepka, thank you so much for being with us. As Elliot just mentioned, unfortunately, the United States crossing that 200,000 mark in the coronavirus death toll today. What are we continuing to get wrong when it comes to dealing with this virus?
Well, first of all, thank you for having me and good evening. So it's really hard for us to imagine what 200,000 is, I think, in terms of deaths. But what it equates to is 1 out of every 1,600 people in the country. And here in South Florida, we've been affected even further. In fact, just to date, we've had 1 out of every 880 people have died from COVID-19 in Miami-Dade County. And not all the deaths have been classified yet from July and August. So this has really affected us in many ways. And I think what we really need to pay attention, what we need to learn is how not to repeat what happened this summer. And what do I mean by that? Well, we're starting to reopen again in South Florida, and we're trying to do that safely. But to do that safely, we all have to do our part. Therefore, people who have any symptoms need to stay home. Symptoms of anything, you just need to stay home until you feel better. Go out and get tested, but then stay home. You need to wear a mask at all times when you're around other people who you don't live with. And then you need to avoid any kinds of large gatherings. So I think really the take-home message is we all have to do our part because we are starting to reopen. There's lots of important reasons why we do need to reopen, but we all have to do our part to avoid repeating our summer.
Absolutely. Dr. Trepka, scientists are warning of a potentially disastrous flu season. Explain the cause for alarm there.
It's the cause for alarm is the potential overburdening of the healthcare system. So every year, the hospitals, emergency departments, clinics are a burden with many, many patients due to flu. Well, that's on a typical year, but this year's not typical. This year we have COVID-19 in Miami-Dade County. We are still having about 400 cases a day. It's likely that we're going to have this problem throughout the fall and through the spring as well. And the healthcare system is not able to take care of COVID-19 patients and flu patients as well. Furthermore, you don't want to go to a clinic or a hospital emergency department if you have a problem with the flu. So for that reason, it's really important for people to get the flu vaccine this year. Every year is a good year to get the flu vaccine, but this year in particular. Everybody who's 6 months of age and older can get the flu vaccine.
All right, Dr. Trepka, you mentioned getting that vaccine. A lot of talk has been about the focus on the trials for the COVID-19 vaccine, and there are some people out there saying they're not sure if they would actually get that. Meanwhile, the flu vaccine is easily accessible. People can get it, and yet they still don't. Year after year, they choose not to. What would you tell the people who still say, nah, I've never gotten one, I'm not going to get one this year either?
Well, all right. So one, you don't want to get flu this year of all years because, again, we're not sure the healthcare system can take care of you this year. That's problem number one. Number two, if you get flu, you can expose other people to flu. And that's why it's particularly important for people who might be around infants to get the flu vaccine so that they can avoid infecting infants, because children under the age of 6 months can't get the flu vaccine. Also, the vaccine is less effective among the very elderly. So if you're around older people, that you also should get the flu vaccine to help protect them as well. So you should get the flu vaccine to protect yourselves, and so that you don't get the flu, avoid hospitalization, and also death as well, because every year we do have several hundred deaths just in Miami-Dade County alone from flu.
Dr. Trepka, I got mine at the local pharmacy. It was easy, and I'm scared to death of needles. If I can do it, anybody can do it. Thank you very much for joining us tonight.